Eric Topol also predicted that in 20 years' time, 90% of all jobs in the British economy are going to require people with digital skills. So this isn't, do you know how to switch it on and switch it off? It's actively use these skills. So how do we prepare for that future? So just to open up some thoughts. I've been thinking about the job I've got to do at HEE by thinking about 4 groups or 4 buckets of staff. The current workforce, the future workforce, thinking about new roles. It picks up on that Andreas, how do you pronounce his surname? Schleicher? The point that he's making about what is it we can predict about 20 years out and what are the jobs that will be there then, so new roles and technologies. And then I want us to think about all of us as users of health and care services and how that technology is not just helping you as professionals, whether you're an educator or a clinician, but how you use technology in your personal life. Technology has democratized the way that we learn and the access we've got to information and how we use that to navigate services. So the first one is really the current workforce. And you know, there's been a renewed focus on the workforce as part of the NHS over the past 3, 4, 5 years. I think we've shifted from money is the biggest thing we need to worry about to thinking about it's the workforce we need to worry about. The paradox we've got is we've got the money very often to buy the workforce. What we've not got is the supply line of the workforce coming through. So how can we think about developing that future workforce? So in HEE, Mike is with me, my colleague who's the regional director for this area. He and other colleagues have been looking at some quite important work about enhancing junior doctors' working lives. Well, I think it's a fundamentally important report about staff and learners' mental well-being, a report that my predecessor undertook, which I think has really began to open up how we support emotionally and psychologically those of you going through medical training and education. And I think the essence of this work is how do we create a more flexible route for learning and how we create more flexible careers as we go through the development of education and training offers. The people plan has been a real opportunity, and the interim people plan. I think, as I say, I've been around health and education for health and care for a long time, and I think what the interim people plan did is bring a number of the national organisations together in a way that I've not seen for a long, long time. And I think the people plan is making that offer. I've been shocked, if I speak honestly, about the fragmentation between national organisations, not just at a national level, but at a local level. If you think about the number of organisations that are essential for the development of a clinician, a doctor, you need professional regulator, you need probably 2 universities, you need an employer, you need a Royal College, you need HEE to do salary support and placement support. So the number of moving parts to get a single doctor out the door is significant. But a lot of those moving parts are not incentivised to work together. There's a fracture and a fragmentation in the way that this works. And so I think the future is really about how at a national, regional and local level that fragmentation is addressed by people working collaboratively. And again, to speak to the title of today, bringing people together in partnerships to ensure you've got that alignment between those of you that are employing, those of you that are educating and training the workforce, along with those of you that are actually going through the process. I think there's 3rd, 4th and 5th year medical students in the room. How that co-production is coming together to generate the future workforce is going to be absolutely essential. And the people plan is really going to be based on that. Trudy's already talked about Topol fellowships and and one of the things I just want to give some oxygen and sunlight to are the development of the digital top-up fellowships, again, designed to actually create the technology leaders of the future by taking clinicians and actually giving them the opportunity to think through a fellowship about the use of technology. And Matthew Alexander, a registrar from Newcastle Hospital, a dermatologist, who's focusing on the use of an app called My Skin Selfie to understand whether it can work as a patient referral to teledermatology, and using that as a tool. Very interesting, technology changing patient pathways, and actually a win-win both for Matthew as the clinician, but also for those of us that are fair-skinned, whose skin is doing all kinds of strange things as we get older, providing some access again for us as patients. So the whole move towards clinical information officers, not just in medicine but also in nursing and other professions, and seeing those roles as part of leadership teams. The second group I want to talk about is the future workforce. Those of you that are medical students are likely to be working until about 2055 if you start work next year. I'll be 100 by the time I get to that age, so I don't think I'll be around to test your skills at that point. But that is a long time for you to work. So how do we think about the ongoing training and education that you will require, when I'm told the shelf life of medical knowledge is about 72 days? So it's come down from years into months and is now measured in days. So what that means is some of this stuff is out of date 72 days after it was agreed. So how do you survive in that environment? And I think that plays to some of the points that Trudy was talking about. But I also believe our future workforce is going to be healthcare will be a team sport in the future, and our future workforce is going to be really about how people work together in teams. So as I've gone around the universities, I've been asking, so you talk a lot about multidisciplinary teams. Will you show me your curriculum, and will you demonstrate to me how multidisciplinary education is taking place? It's a very, very interesting conversation when you get into it. This is my point about how we close the gap between our ambitions and actually the reality on the ground in the way that this takes forward. So I think viewing medical education, healthcare education generally, as a part of the multidisciplinary team. And why do we need that? How can we prepare students to work in teams where we want people to be working to the top of their scope of practice, and constantly bringing change and support across that? And again, I think where you've got a world shortage, a global shortage of healthcare professionals, then I think there's a greater imperative to accelerate some of that work rather than wait until that hits us and then think, now what are we going to do? We know this is coming. So it's important that we prepare. A big theme for me, so I'm both my parents were textile workers. I was the first child to go away to university. My hometown is Blackburn. There's not a single textile mill working in Blackburn today. My route into what I've been doing throughout my career has been through education. So promoting widening participation and social mobility through the way that the education is offered, and thinking more broadly about those concepts, is hugely important to me personally. I've been really thrilled to learn of the work that you're doing here in Leeds to open up those opportunities for young people in Leeds to do this. But again, against that global shortage, where I don't think international recruitment is going to be more than a supplement to what we need to do over this next period of time. Thinking creatively about how we create our own future workforce is going to be key. And I've been absolutely thrilled to learn on some of the things you're doing here in Leeds through the university to actually widen participation and draw people in to the workforce. I've been asking, I'll not do it now, but I've been asking, are there any millennials in the room? I guess there are, just by looking round. And the reason I've been asking this, I've been fascinated to actually understand, as a baby boomer, whether the attitudes around the millennial generation are actually different to the attitudes for my generation of baby boomers. And where I've got to on that is I don't think, I've got two sons who are millennials, I don't think they care any more or less than I did about key issues. I don't think they work any more or less hard than I did about key issues. I think the key difference, though, is their emotional and psychological contract with work is different to mine. I think I was expected to put up with things that I don't think they will put up with at all. And how we begin to reflect that changing attitudes around work is going to be crucial. They want much more flexibility and agility about their working experience. And I think it's beholding on us, those of us that are designing educational and work experiences, that we acknowledge that attitude to work is changing. So these issues about people being able to step on and step off medical education become absolutely critical, and how easy or difficult we make that is going to be significant into the future. But that's not just for the education of undergraduate and postgraduate. I think that's going to be something that needs to take place throughout people's careers. So the entrepreneur program that you're running here, I think will chime with many young doctors that I've spoken to who've taken a year or 2 or 3 years out to develop digital platforms and digital tools, but have only wanted to do that as a project or as a program because they have wanted to come back and practice medicine. And how we actually facilitate that, because in the past we've lost too many people when people have said, you can't do that. And they've said, okay then, well, I'm going to do this. And I think we need to reflect that much more. And then I've probably gone on too long. So the last bit I just want to reflect on is how we use technology as patients, people that are using services to navigate. Most of us will know, for instance, people who are self-monitoring, people with diabetes who are self-monitoring. And those individuals probably know as much about their condition as some of the clinicians that are treating them. That's not a bad thing, that's a good thing. And how do we use the energy that those of us that are prepared to self-monitor, to use data and technology to help ourselves manage our conditions, becomes a key issue. And I think what technology is doing is changing the nature of the relationship between those of you that are providing care and those of us that are receiving care, and sets up a different conversation between us around how, particularly those of us that have got long-term conditions, and there's about 15 million people with long-term conditions in the UK at the minute, how that can be dealt with. And where I've seen this used effectively in places like Milton Keynes, they're absolutely reducing with dramatic impact the number of people that have to go through outpatients, because the self-monitoring is going on between the individual citizen and their clinician. And people are not turning up in outpatients appointments and actually sitting for hours waiting to be called, because that's being done in real time. So it's a win-win. It's a win for the individual citizen, and it's a win for the individual clinician as it goes through. So they're the 4 buckets that I've been thinking about the future workforce in. And I am going to join you through the afternoon, and I'm really interested, particularly for those of you that are medical students, to come and listen to your perceptions on both what I've said today, but also your thoughts on where your careers are going. The other treat for me is having spent all morning with the people that are teaching you, I now get to listen to those of you that are being taught about your perceptions as well. So thanks very much for listening.